I'm Dr. Jim Boccuzzi. I practice in Danielson, Connecticut at Killingly Eye Care. Macular degeneration is the leading cause of blindness in people in the United States over 50 years old. There are basically two forms of macular degeneration, a dry form, which is the more common form, and the wet form. This form is about 90% of the severe vision loss. Risk factors for macular degeneration include your ethnicity, Caucasian being the higher risk factor. It can also include age, smoking, hyperopia, which is farsightedness, and hypertension, also being female. Today we know we can alter the course of this disease with the use of supplements like fish oil and lutein are what are used today to help alter the course of this disease. And changing your lifestyle, things like sunglasses and wide brim hats will help protect your eyes. In the more severe forms, injections can be used. It is often painless, very quick, and the effects are beneficial very quickly. Quite often during the course of an eye examination, we will dilate the pupils and take a thorough look at the retina. With the pupil dilated and the retina observed under binocular conditions with lenses that we use, we can get a nice magnified 3D look at the back of the eye. And from that, in fine detail, we can see if there are any early signs of macular degeneration, which might be small pinpoint drusen, which are little white yellowish flecks in the back of the retina, or pigment changes in the retina. Once we detect those, we can discuss with the patient further testing. Some of the testing might include something called a PHP that's very sensitive in picking up changes in our macula. We also have an instrument called a Quantify, which measures the density of a pigment layer. The pigment layer is a protective layer in the retina that helps absorb light as it enters the eye. And if that layer is thin, we have supplements we can use to improve the thickness of that layer to protect the macula. One of the tests that we use to diagnose macular degeneration is called an OCT scan. This is optical coherence tomography. This is a quick, painless, easy scan that allows us to view the retina in detail, and we can determine if there are any subtle effects of macular degeneration that we will not be able to see otherwise. The technician will have you seated in front of the instrument. You'll be looking at a little blinking light, and it's about a 2 to 3 minute scan, so very, very quick, and you just look straight ahead and we'll take care of the rest.
I'm going to have you put your chin in the left chin rest and forehead against the bar. Just go in there nice and straight. Good. We're just going to get you set up here. Great. And I just need you to look straight ahead at the center while we get you lined up. Okay, perfect.
People should come in for routine vision exams even if you're not experiencing symptoms, because a lot of the more serious things that can occur with eyes may not have symptoms. So it's up to us to detect the subtle changes and intervene so that we can protect and preserve your vision.